What are we assessing when we look at this? So we want to know their age, because when we look at their age, we can understand how well they may tolerate this. And then also you want to have, I don't know if I want to see that screen. Okay. You want their age. Basically, you're going to understand what's the detailed description of their symptoms. When was the onset? What does it look like? Have they been sick for a couple of days? Was it recently sick? Are there other family members that are sick? Do they have any past medical history? Because if they have any type of past medical history, maybe they were a preterm infant, then you know that they're more at risk for having more frequent respiratory issues or concerns. Is there smoking in the home? Are there things like that? Those are the things that you want to consider when you think about environmental factors, okay? And then also, if you have an infant that is having respiratory distress that was presented to you, and they were a burn victim, then you actually would be thinking about carbon monoxide inhalation and what that looks like. You need to understand what that looks like in the infant or in anybody who has experienced burn inhalation, okay? So feeding and sleeping patterns. What has the baby been doing? How long has their respiratory distress been carrying along? Are there any wet diapers? What does that look like? So those are things that you need to think about and consider when you're making your nursing assessment for a patient that's presenting with respiratory distress. Okay, so the other thing that we're at our objective assessment is we're looking at them. What do they look like? Is it a 6-month-old that's sitting up and smiling and looking at their mom? You over here as a nurse, they're looking over at the mom and they're not looking at you. That's generally a really healthy baby. They're generally comfortable. They're still, paying attention to their mom. If you have a 6-month-old that is either staring through you or just looking off and not interested in their parents or not interested in who they know, then that's usually when I look at that, I'm thinking that someone who's probably in some sort of distress, and that they're a little bit more severe than you would think that the general person is. That comes in. Do they have anxiety? What do you palpate? Are you able to palpate good pulses? Are they weak pulses? Are you able to palpate the brachial pulses, or do you need to go to femoral? What does that look like? And then also, is there any swelling or tenderness? Are they diaphoretic? Are they like I had mentioned earlier, the child cannot regulate their body as well, so they do have diaphoresis, and usually diaphoresis is either is associated with certain heart conditions. Okay.